A very good afternoon, everyone. My name is Siddharth Tallur. I'm sorry I'm not able to be there in person with you to make this presentation, but I thank BETIC and WRCB for allowing me to share a pre-recorded version of this presentation with you, and I'll be around to answer any questions that you may have on our work. So today I will talk to you about work we have done on early detection and low-cost point-of-care monitoring devices for cardiovascular disease biomarkers. I'll tell you about the work we have done so far and what we plan to do next. The work we have done so far was funded by grants received from WRCB and BIRAC. The medical problem that we are trying to address is development of a device much like a glucometer, but for detection of cardiovascular disease biomarkers in blood. We would like to develop this device in a manner so that it can be sold as over-the-counter test. A patient that is suffering from chest pain could then access such a device to rapidly determine the course of action they need to take in consultation with a physician through either in-person visit to a clinic or over telemedicine. The unmet clinical need here is that such a test does not exist for chest pain diagnosis and managing heart diseases. In the last 2 years, we have seen how having access to a rapid antigen test for COVID 19 allowed better management of the disease for patients that were experiencing symptoms. The other unmet clinical need here is that typically the kind of test that one needs to undergo if you are suffering from chest pain, such as ECG blood tests that are mentioned in the bottom left there. These tests are not accessible across rural areas, and one can typically access them through sporadic screening camps, but then they are not truly on demand. Uh, like I mentioned earlier, one has to run these tests, then one has to wait many hours for getting the results, and then one has to consult with a physician. So these are not suitable for teleconsultation as well, and therefore they result in unequal access to timely expert diagnosis uh, for a disease such as heart attacks. Here is our proposed solution. Let me start with what we see under core technology on the right. What we have developed is an assay based on printed circuit boards. We use these directly as electrodes. These electrodes are then connected to a potentiostat that we have developed in our lab, which connects to a smartphone. As you can see in the photograph in the left panel, these are then connected to the smartphone, and then one can obtain a result in a matter of a few seconds to decide whether the biomarker concentration in the sample is normal or abnormal. What we have shown in the bottom left is a result for one of these biomarkers called myeloperoxidase, abbreviated as MPO, that was obtained with these sensors. Let me show you a short video now that just illustrates how the sample is introduced on the sensor. This also has a microfluidic channel that's patterned on top of the printed circuit board. So as you can see here, the sample is introduced. It then flows over the electrode, collects at the other end. We can wash this by passing a washing buffer, and then you have a wicking pad that collects the excess sample, and then one performs the measurement. Of course, what I show in the video is just a demonstration unit. That's not the actual sensor. You can see the actual sensor photograph on the in the image where it's connected to the potentiostat and the smartphone. The wicking pad is also a part of the device. So in this work, we are focusing on detection of two biomarkers. One is myeloperoxidase, which I mentioned just now. This is an early warning biomarker which is released in blood at the start of vascular inflammation, and it elevates much in advance of heart attack or myocardial infarction. The other marker that we want to work with is anti-proBNP. This has clinically been proven to be useful all the way from initial diagnosis to prognosis and long-term disease management. We are developing technology now that is a multiplex sensor which can detect both MPO and NT-proBNP concentrations simultaneously with a single sample, that is a single drop of blood. And like I mentioned, our technology is based on these low-cost printed circuit boards as sensing substrates. So our innovation lies in the methods that we have developed to make these surfaces anti-fouling, corrosion resistant, and to have a long shelf life for these electrodes. This is my last slide, and after this, I will be happy to answer any questions that you may have. So, the potential impact that we see for this technology, I can talk about it in two types of use cases. The first use case is where the potential customer is a primary healthcare center or a hospital where one could visit if one is experiencing chest pain. The physician there can run an ECG test and run this test, and the results together can be used to decide whether or not the person is suffering a heart attack, and then accordingly decide what treatment they need to take up. The other use case is where, let's say, there is an individual that does not have easy access to a healthcare facility. Let's say one of the users that I mentioned earlier in rural areas. Here, if we could sell this as an over the counter test, then one could administer this test themselves, like one would use a glucometer or this COVID 19 rapid antigen test, and then consult with a physician through teleconsultation, and then figure out whether or not they need to report to a primary healthcare center or a hospital urgently, or if what they are suffering is not a heart attack, and if they can wait a while to seek medical attention. In summary, we have developed a proof of concept of this technology for myeloperoxidase. We are in the process of filing a patent on this technology. We have filed one before, and we are also in the process of writing up this work for a manuscript. The multiplex sensor development, where we can test both myeloperoxidase and NT-proBNP with a single sample of blood, that test is still under development. We would like to take up clinical testing and manufacturability, understanding reliability of these sensors, for which we need additional support. So if you are interested in our work, please reach out to us. We are very happy to discuss with you and see how we can work together. Thank you.